then you know how to react and respond in an appropriate manner. All right. So I want to talk a little bit about body fluids and electrolytes. Is nothing hard about that. The body fluids and electrolytes, which make up the fluids in our body, and the principles of dialysis and how that applies to dialysis. And hopefully that will get you to see the more dialysis, the better, what options may be the best for you, and to manage your disease in a way that will make you live a quality life. So what are the body fluid compartments? So look, the body is composed mostly of fluids. Water makes up approximately 50 to 70% of weight of an adult. Fluids are distributed among the cells, tissues, and blood vessels, and each location is called a compartment. So you got your intracellular compartment, which is inside the cells, okay? Then you got your extracellular compartment, which is outside the cells. Then you got your intravascular, which is inside the blood cells. And then you got your interstitial, which is between the cells. So homeostasis, all right, that's when your body's in a balanced state, right? So when you go to dialysis and your numbers are off, it's not in a homeostasis state, all right? Like a state of equilibrium in the body. What are electrolytes? So the electrolytes that's in your bath that they use to clean your blood for dialysis, those are electrolytes. When they say, what bath are you on? What dialysis bath are you on? That bath is composed of electrolytes, right? So electrolytes are charged particles that can conduct an electrical current. Electrolytes in the body control motor, muscle and nerve function, and maintain the body's homeostasis. Now, why is that important? If you're a dialysis warrior, if you're on dialysis, why is electrolytes important? I just read electrolytes are charged particles that can conduct an electrical current. Electrolytes in the body control motor, muscle, and nerve function and maintain the body homeostasis. The reason why that's important to you, because how many people's phosphorus levels are high and you experience some effects because you have high phosphorus or low phosphorus, or high calcium or low phosphorus? Those are electrolytes. What about potassium? That's an electrolyte, right? If your potassium is high, it's going to throw off your heart rate and it cause you to go into cardiac arrest. That's why electrolytes are important, and that's why kidney warriors should know about this. So you don't go out and eat a lot of bananas that have potassium in it, or you go and indulge in food that has high phosphorus in it. You got to play this smart. You got to be health smart about this, okay? The most important electrolyte to consider in uremic patients are, again, the most important electrolytes to consider in uremic patients, and that's patients with kidney disease, are sodium, potassium, calcium, phosphate, magnesium, and bicarbonate. That's why we take those labs when patients come into hospitals to check those levels out, especially the bicarbonate level. If your bicarb level is low, you're going to be acidotic. You're going to be hyperventilating. You're going to be respiratory distress, blowing off CO2. What is pH? Now know about when people say the pH in the water 7, or you should get that water that's got 9 pH alkaline. So this is the skinny on that. What is pH? The measure of acidity or alkalinity of a solution. All right? What is pH? The measure of acidity or acid or alkalinity or bicarb of a solution. Just like they test the pH in a swimming pool when they go swimming. pH is based on the number of acid ions. So for instance, less than 7 pH, you're more acidic. More acid ions is acidic. If your pH is greater than 7, it's more based or alkaline. That's why they talk about these alkaline diets. The more acidic your body is, the more subjective you are to infections and diseases, because they thrive off of acid, acidic. 7 now is the equal number of acid and base ions is a neutral substance. 7. So blood pH is maintained by the actions of buffers, and normal pH of blood is 7.35 and 7.45. Now you hear me talk about bicarbonate. Same as baking soda, right? Bicarbonate is the same as baking soda. Is a buffer that helps to maintain a constant pH in a solution, even if an acid or base is added. That's why some warriors, your doctors may give you sodium bicarbonate tablets, because your inside of your body is acidic, right? Your CO2. That's how they measure that. Now listen to this. Healthy kidneys maintain normal body pH by making and regulating bicarbonate. The body uses bicarbonate to neutralize acids formed when cells metabolize proteins and other foods. And basically it's just saying when foods are broken down, the bicarbonate neutralizes the acid that's in that food. That's what healthy kidneys. But if you got kidney disease, you're on dialysis, that doesn't happen. All right? Your body is more acidic than it is bicarbonate or base or alkaline. So that's very important to know that. Again, healthy kidneys maintain normal body pH by making and regulating bicarbonate. Now, if healthy kidneys do it, if your kidneys are not healthy, then they're not going to be regulating nothing. The body uses bicarb or bicarbonate to neutralize acids formed when cells metabolize or break down proteins in other foods. There is a lack of bicarbonate in patients with renal failure. Let me repeat that. There is a lack of bicarbonate in renal failure. In patients with renal failure. It's right here. It's right there. I'm telling you, but they don't tell you this. If you don't know, how are you going to manage your life? How are you going to manage the disease? All right? How are you? What about your mom, your dad, your loved one, if they dealing with this? Share this broadcast, guys. We only got 3 people watching. Now, that's okay, because I'm still going to teach. Because the information has to get out there. Whether you hear it now or the people come back at a later time and watch this broadcast. We're putting it out there. You can't get this information nowhere else. I'm serious. CKD patients can't excrete enough acids in urine and are in a constant state of metabolic acidosis. Now, let me repeat those 2 things I just said. And just, if you're a dialysis patient, please think about that for a minute. Or if you are a family member of a dialysis patient, think about what I'm about to say, okay? Because this is important. Bicarbonate is a buffer that helps to maintain a constant pH in a solution, even if an acid or base is added. Healthy kidneys, which dialysis patients don't have, healthy kidneys maintain normal body pH by making and regulating bicarbonate. It's making and regulating it. The body then uses bicarbonate that it made, right, to neutralize the acids formed when cells metabolize or break down the proteins and other foods. Now, that's what healthy kidneys. Listen to this. There is a lack. We all know what lack means. Not enough. There is a lack of bicarbonate in patients with renal failure. CKD patients can't or cannot, however you want to say it, excrete or get out of their system enough acids in the urine, because you can't urinate or you don't urinate enough, and are in a constant state of metabolic acidosis. And you may be asking me, Steve, what the F is metabolic acidosis? You're throwing out these medical jargons, metabolic acidosis. I hear about it in the hospital. My doctor talks about it. You're in a metabolic acidic state. Metabolic acidosis, all that is a state of too much acid in the blood. So you're already fighting coming out of the gate with kidney disease, because it says CKD patients can't excrete enough acids in urine and are in a constant state of metabolic acidosis. Metabolic acidosis is a state of too much acid in your blood. So this is something else important. Again, we only got 2 people watching, and I swear to God, I feel sorry for the people that could be watching. I'm sure, it's a Monday night, work night, 9:36. But if you're on dialysis, doesn't your life mean more to you with information coming like this, that the people at the clinic don't even have the decency to sit down and just discuss this with you and leave you in a constant state of metabolic acidosis? So, let's talk about how hypertension is treated. Do you have high blood pressure? Do you? Do you have high blood pressure and would like to know how high blood pressure or hypertensive is treated? If you want to know that and other information, important tips and information from a 33-year nurse veteran, stay tuned, share this video, and come back right after this PSA.
Do you know you could have kidney disease and not even know it? 9 out of 10 people who have stage 3 chronic kidney disease do not know it. The rate of kidney failure for African Americans is 3 times higher than among Caucasians. And one reason for this is that they are not aware when they have earlier stages of kidney disease, at a time treatment could prevent the damage from progressing to the point when dialysis or kidney transplantation is necessary. In addition, due to high rates of diabetes, high blood pressure, and heart disease, Blacks and African Americans have an increased risk of developing kidney failure. African Americans need to be aware of these risk factors and visit their doctor or clinic regularly to check their blood sugar, blood pressure, urine protein, and kidney function. Be aware. Get tested. The life you save may be your own. For more information, contact urbankidneyalliance.org.
All right. So how is high blood pressure or hypertension treated? How is it treated? Hypertension is commonly seen in chronic kidney disease. So if you got chronic kidney disease, you're more than likely to have high blood pressure. Can't get around that. It is a cause of CKD, right? All right, high blood pressure is a cause of CKD, all right, and a result of CKD. So it's both ways, right? It's a cause of CKD and a result of chronic kidney disease. The dialysis treatment removes excess fluid, which is a contributing factor to hypertension. In addition, antihypertensive medications may be prescribed for patients. Typically, antihypertensive medications are administered to patients with blood pressure readings of 140/90 or higher. However, for diabetic patients or patients with renal disease, antihypertensive medications may be prescribed for patients with BPs at 130/80 or higher. There is evidence that certain medications like lisinopril, which is a beta blocker, which are a family of blood pressure medications, can also slow the progression of kidney disease. Let me repeat that, all right? Especially if you're in stage 1 to 5. It says, there is evidence that certain medications like lisinopril, beta blockers, which are a family of blood pressure medications, can also slow the progression of kidney disease. And that's why I said it's very important. If you at stage 3, you can halt that progression if you know, right? But if you don't know that there's medications out there that can slow the progression and stop it, you're just going straight on to dialysis. Particularly in diabetics. Patients may be prescribed blood pressure medications for reasons other than hypertension. All right, let me see. Now, if you're on dialysis right now, receiving incenter hemodialysis, or maybe at home, this could be important as well. When is the machine temperature checked? In the incenter, right? I'm reading information for staff that says, when is the machine temperature checked? So evidently that must tell you that the machine temperature has to be checked during your treatment. Is that taking place? Do you know about that? Did you know if you're on dialysis at the incenter that they're supposed to be checking your temperature? Maybe the temperature is 35.5 and you don't know that, or the technician, and you complain about being cold. Well, why do you think you cold? The machine temperature is at 35.5. We put machine temperatures at 35.5 if a patient has hypotension, which is low blood pressure, so they can shiver and increase that blood pressure. But if your blood pressure is okay, you come to dialysis, you getting in the chair, you thinking everything's set, and your temperature is at 35.5 and you wonder why it's cold and everybody else feels okay. Have you ever thought about that? But do they tell you that? It's like I said, it's 3 people watching. Out of this 3, I don't know how many of them, on dialysis, but I know that there's more than 7,000 dialysis clinics, right? More than probably 500,000 to 700,000 on dialysis. And I know all of them, maybe some people on dialysis know this information that I'm saying. I'm not saying all of them don't know, but I bet you the majority don't know this information. That's why there needs to be more than 2 people on this broadcast. I don't know if they're kidney warriors or family members or random people just watching me talk about some medical dialysis that they have no knowledge about. But this is important, guys. This is very important. And I'm not going to stop. I'm not going to stop till there's like 50 or 100, more than that. Even if it's more, I'm not going to stop. But we have to do better. We talk about, they not broadcasting or showing information about kidney disease or making it mainstream. What do you think? If there's no freaking voice behind it to make it be known, then they ain't going to care. It's just like in the dialysis unit. Goddamn staff complain about DaVita or Fresenius. Oh shit, man, I gotta do this, I gotta do that. They making me do this now. They ain't paying me enough, or now they adding more work, or they cutting this out or cutting that out. But yet when it's time to go knock on the freaking door to start talking about it, and you look around, shit, ain't nobody behind you. They back at the machine, mulling around, shuffling around, pissed off. So that's what I'm saying. It's the same way. Even if you're a patient and there's something at your unit you don't like, instead of taking it on by yourself, get other patients involved. There's strength in numbers. Especially at these dialysis units. They don't like no damn media attention. Alright? Just like that nurse in Texas back in 2008 that put the bleach in the lines. You don't think this shit happens? I'm not saying it happens now, but just for one person to do that can give someone else who's mentally unstable, who comes into work in dialysis, the thought process to maybe want to try something like that or something bigger. Don't get it twisted now. There are medical doctors and nurses that did harm to patients that's locked up. Mercy killings. So don't think dialysis is immune to that. Don't think dialysis is immune for someone to come in who feel like that their life has no meaning and shoot up the place. This is real. That's why you have to be on the defensive. You have to pay attention what's going on in the dialysis unit, right? You have to. We are living in dangerous times. Let's not make no mistake of that. In kidney disease, people on dialysis, they go to the clinics, and the patients that deal with the disease are not immune, right? They're not immune from mental illness. So if you got someone that's dealing with, one, a mental illness, two, dialysis, three, cannot get a transplant, right? And four, maybe just been diagnosed with a terminal illness like AIDS or cancer, and they get mad at somebody or don't like the system or what's happening in the unit, you don't think handguns are readily available? No one wants to hear this, but this is the truth. And the more you know, the better you can be prepared or make an informed consent, right? Even with staff members, you cannot take them for granted. I don't care how long you've been going to that dialysis unit and how long you know them. They're only going to let you know what they want you to know. Vice versa. So, when is the machine temperature checked on the dialysis machine while you're undergoing hemodialysis at an incenter unit? Right? When is the machine temperature checked? Because if anything happens with that temperature, your blood, what can happen to your blood is called hemolysis, the destruction of red blood cells, which can cause anemia and other problems. Read the machine temperature when the conductivity and temperature are stable. Document before the treatment is started. It tells the worker to document the temperature and the conductivity. The conductivity is the bath. Before treatment, they need to know that before treatment. You got some staff that hook up and don't document. Check this out. When might it become necessary to hand crank the blood pump, and what precautions need to be taken when doing so? How many warriors out there are on a Fresenius dialysis machine? Come on, give me some thumbs up. I got a watch party. There's only one person in there. That's me. That's okay. But on the live broadcast, it's 3. So this here right again, this is some important information that people are going to miss. So if you're on dialysis and you're watching this now, and if you're on a Fresenius dialysis machine, they have something in the back of the machine called a hand crank. And that hand crank is very important. And you have to make sure your machine has a hand crank on the back, right? The reason for this hand crank is if the electricity or the power goes out, right? We can't reset the machine for it to come on to return your blood. They got to hand crank it back. Well, if the power goes out and the damn hand crank on the back ain't on the back of the machine, then you got the freaking tech or nurse running around like a chicken with their head cut off, trying to find a freaking hand crank when it should have been on the back of the machine. But a lot of people on dialysis don't even know about a hand crank, not even thinking about a hand crank. And so when the power goes out or something happens where it renders the electricity to go out, right, and you looking and wondering what's happening, and there's no hand crank, but they're not telling you, they pretending like they got it under control. And the next thing you know, they tell you they gotta throw out your blood. This shit happens. I experienced that. I seen it. I wouldn't be emphasizing on it if I didn't see it for my own eyes. Okay? I wouldn't be talking about this if I didn't experience this with my own eyes, with inexperienced techs and units that was ill prepared with hand cranks. So again, it says, witness asking the employee, right? When might it become necessary to hand crank the blood pump, and what precautions need to be taken when doing so? If they're going to put this down, evidently at some point a hand crank is going to need to be used. Hand cranking the blood pump may be necessary due to machine failures, machines accidentally becoming unplugged, overload of an electrical current circuit, or a power outage in the area. These stuff can happen and do happen. But if you're on dialysis and you don't know nothing about a hand crank, and you don't know what's going on when this happened, it's a possibility that you can lose your blood if you don't know. And like when that power goes off, you don't know because everything was shut off. And all the machines will start beeping. Beep, 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 beep. Right? You looking around like, what the hell is going on? And again, wherever you at, I don't know the patient ratio, but here in Maryland, the patient ratio is 3-to-1, meaning there's 3 patients to 1 staff member. So if they're short, right? If you happen to be there on the day that they're short of staff and it's a 30-chair unit and you got 2 to 3 call-outs and the freaking electricity or the power goes out for more than 20 minutes, what are you going to do? It happens. Don't think it can't happen to you. If it hasn't, it just haven't yet. Lord forbid that if it happens. But you can't deny this stuff can't happen because they wouldn't talk about it. Again, hand cranking the blood pump may be necessary due to machine failures, machines accidentally becoming unplugged, people trip or accidentally pull out the wrong plug. I've seen overload of an electrical circuit when some dumbass staff may plug in 2 machines in 1 outlet, or a power outage in the area. When hand cranking the blood pump, the venous, now check this out because you can see a lot of blood doing this. Check this out. Pay attention to what I'm about to read. When hand cranking the blood pump, the venous tubing, right? Let me get it. Share this broadcast, guys. Don't hog up all the information. Right? The venous tubing. They're talking about this. Right? So, if your machine cuts off due to electrical power, somebody unplugging the machine or some shit, tripping over it, power failure, when hand cranking, when this is necessary, when hand cranking the blood pump, the venous tubing, right? This right here must be removed from the air detector line clamp. So it's a clamp right like on the machine. This tube goes into this piece that has a clamp, because if say air get in the line, right? Say this is the air detector. It's a piece right here, like where my two fingers at. It's this piece on the machine that it's a sensor right here. So it monitors if the blood gets below that sensor, it can shut off the machine, right? Stop the blood pump, and it clamps the line so it prevent air from getting in the patient. So if the power shuts off, then all that's going to shut off, right? And this is going to be clamped. So if the technician or nurse is trying to hand crank you because they're rushing, right? And they don't remove this out of the clamp, it can back up pressure and it can blow this top off and blood can get all over the place. So it says, when hand cranking the blood pump, the venous tubing must be removed from the air detector and line clamp. This poses a risk of air embolism when the air detector is not armed. Observe carefully for the presence of air in the circuit and level of blood in venous drip bulb, which is, this is the venous drip bulb. That's what they call it, right? Hand cranking on the Fresenius K machine is facilitated using a handle found attached to the back of the machine. So when you go sit down, make sure that hand crank is on the back of your machine, or ask the nurse or your technician. A lot of times when they're not back there, you don't know, because you don't know about the hand crank. But I'm telling you tonight. I'm telling you tonight. Then it says, is facilitated using the handle found attached to the back of the machine. Manually turn hand crank clockwise, right? Slowly, approximately 6 to 10 rotations per minute. Maximum hand cranking time should not exceed 15 minutes. Now, I don't know how many people watching this is on dialysis if they knew that. So, I'm just trying to give you the information, man. That's all I'm trying to do. So, if the power cuts off or anything like that, your machine stops or breaks down, and you see the technician looking around this shit, right? You trying like, what the hell going on? He looking for that hand crank, right? He's looking for that hand crank that should have been on the back of the machine. So when you go into treatment tomorrow, all right, if you got treatment on TTS, go in there before you get down. Like if you got your coat, you can just pretend like you putting your coat on the back of the chair, or straighten out the sheet if you have one on the chair, or just go behind and look behind the machine. And it's going to be attached to the machine. It's going to have a black knob on it, right? And it's going to be snug on the back of the machine. It should be there. It has to be there, because if it's not, then you're at risk, because if that machine cuts off or the power fails, then how are they going to hand crank your blood back? And you may end up losing it. So let's talk about patient evaluation and assessment. This is what they tell the nurses, right? I don't know if you can see this. See that? Patient evaluation and assessment. Probably can't see it because it got yellow highlight on it. But I just want to show you this is what they tell their people. And their people are not going to sit there and explain what the company is teaching about your disease. How to treat your disease. So that's why I'm going to arm you with this information. All right? Patient evaluation and assessment. Right after this PSA.
Chronic kidney disease is a serious and growing public health problem in the United States. More than 20 million Americans aged 20 and older may have chronic kidney disease. In addition, many African Americans with risk factors, diabetes, and high blood pressure do not know they are at risk. Are you at risk? Be aware. Get tested. For more information, contact the Urban Kidney Alliance, Inc. at 443-814-1541.
Alright guys, I'm back. Now look, we're going to talk about something that's very, very important. I don't have too much time, but share this broadcast. I'm telling you, we're down to the minutes now. But what I'm about to tell you is very important on your care at the dialysis unit. And that is patient evaluation and assessment. Nurses have to do an assessment on patients at the dialysis facility. What must be evaluated and documented pre-treatment? They're asking that in this education pamphlet to the caregiver for the nurse. It says what must be evaluated and documented pre-treatment, meaning before you go on dialysis. Something has to be documented and evaluated before you go on dialysis. Did you know that? If you're on dialysis right now, did you know that the nurse must evaluate you and document certain information before you go on dialysis? Did you know that? One is ambulation status. How you walking? Your mental status. Changes in patient condition. Pre-wait as witnessed by staff member. Blood pressure sitting and standing if patient is able. Heart rate and rhythm. Respirations. Edema, which is fluid in your lower extremities or in your arms or hands or your face or your eyes. Your GI status. Are you nausea, vomiting? Did you have any nausea and vomiting over the weekend? Or did you have any between your last treatment and in this treatment? Your skin color. Your access evaluation. What's going on with your graft? Is it a bruit? Any signs of infection? Hospitalization since your last treatment. Did you go to the hospital? In addition, any new complaints or life changes. Example, patient's spouse expired. Of course, if you have something like that, you want to know as a nurse so I can know what your mental status is. Is that affecting your eating? Are you in over or under your weight? That could be affecting your appetite. Current time of evaluation that I did this assessment. Your blood pressure, your blood flow rate, your dialysis flow rate, safety checks on the machine, arterial venous pressures, fluid removed, administered, access checked, right? Patient overall status, any interventions and patient response, any change in dialysis prescription. Example, did the doctor increase or decrease the blood flow rate due to arterial pressure alarms? So there's so much you need to know that a lot of patients don't know that's supposed to be happening, but the patient think it's happening in their mind that everything is going by clockwork, but they don't know. If you don't know what these people are supposed to know, how do you know everything is going the way it's supposed to be going, is what I'm saying. So if you know, right, that the nurse is supposed to be asking you certain questions, supposed to be checking your heart rate, your respiration, checking your pulse, checking your breathing, checking your GI status, which means your stomach, if you got any stomach pain, any nausea, vomit. If they don't ask you those questions, don't take for granted they say, I forgot. No, that's being lazy and not doing your job. Right? I'm going to show you what this says. And you're not going to see the highlighted part, but I'll read it to you. This is what people are supposed to know. The staff, right? Are you being treated that way? I want to read you what the highlighted part said that you couldn't see because of the green screen effect. It says, what must be evaluated and documented after treatment when you leave? Your ambulation status, meaning how you walk, your gait. Your mental status, changes in condition, your pulse weight, as witnessed by a staff member, blood pressure sitting and standing if able, temperature, heart rate and rhythm, respirations, edema, any new complaints during treatment, evaluation of your access, including presence of a thrill, conditions of dressing if you got a catheter, escort a patient to scale and waiting room. Note, any patient evaluations, this is in the highlighted, any patient evaluation findings outside of normal parameters requires RN notification and assessment. So the staff, if you got a technician, your blood pressure 200 over 110, right? And they say, oh, Miss Smith, your pressure high, 200 over 110. And they let you leave out like that, and they don't come tell a nurse, they're effing crazy. They're supposed to come and tell the nurse that you got a pressure of 200 over 110, but a lot of them don't do it. So now you're walking out of the door, right? Because you want to catch transportation at 200 over 110 that put you at risk for a hypertensive crisis. That's what we're talking about being mindful of your treatment. Because if the technician don't tell you that's high and say, wait, let me go tell the nurse, and you don't realize or recognize that your pressure is 200 over 110, you're going home with the potential of having a hypertensive crisis at home, a stroke, right? Something that's going to land you in the emergency room and make the situation more worse than it was. When if they would have told the nurse at the unit before you left, we could have gave you some clonidine or something. What else is supposed to be taken? Your temperature after treatment. The normal body temperature is 98.6 or 37 Celsius, with a range of 96.4 to 98.9. Many renal patients have below normal body temperature and an elevated pre-dialysis temperature may indicate infection. Let me repeat that. Many renal patients have below normal body temperature and an elevated pre-dialysis temperature may indicate infection, especially if you have a catheter. Elevated temperature requires investigation by the nurse before treatment begins. So if your temperature is high, right, I need to know that before you go on dialysis. But what happened, they don't get your temperature after you're on the machine. Your pulse rate. The pulse is elevated for rate, rhythm, and quality. What if your loved one or you are on digoxin, which helps regulate your heart? The pulse, your heart rate. The pulse provides baseline information. Again, the pulse provides baseline information. So I got to know the baseline. If you come in at a pulse rate of 80, right, pre-treatment, and you leave out, your pulse is 130, something's going on. But if nobody tells me, that's out of the parameters. If no one tells me, right, I won't know. It is evaluated, the pulse is evaluated before treatment initiation to detect rate and abnormal rhythm, guys. I'm not making this up. That's why please share this broadcast. Tell people what I'm talking about. Have them check me out. We gotta get this information out there so other warriors can know. Like if my mom, right? If my mom is 85, 70, in her 90s, and I'm taking her to dialysis, right? And then I hand her off into the hands of the staff, trusting that they're going to do the right thing, right? Take my mom in the chair. She's sweet. They always talk to her. Mrs. Belcher, nice lady, right? Get in the chair. That don't mean because my mom a nice lady that somebody's going to evaluate this shit. You know what I'm saying? That don't mean they're going to take my mom's pulse and take her temperature before the treatment. They may forget to take her temperature or check her respirations, right? It says if the patient develop chest pains, arrhythmias, or other symptoms during the treatment, the emitting pulse can be compared to the current pulse. So if my mom complained of chest pain during treatment, and no one or the tech forgot to get the pulse pre-dialysis or something, how I'm going to compare and do data analysis? How? The pulse can also be an indicator of the patient's volume status. Meaning, if you get off dialysis and you're dehydrated, they take off a lot of fluid, you're going to have a high pulse rate. That's how it goes. But if you don't know that, right? You get off the machine, your pulse rate high, you feel lightheaded, you may be below your dry weight a little bit, and you think that's all right, I'm going to take off some extra fluid for the weekend. But you're killing yourself at the same time. So that's why a lot of people, if you don't have any problems with your heart, and at the dialysis you always find that your heart rate is up and you're a little bit below your target weight because you're trying to pull off some extra fluid because of the weekend, that doesn't make any sense. Why do you want to pull off extra fluid for the weekend so you can put more fluid on? That doesn't make any sense. Why would you want them to take off extra fluid for the weekend just to put it back on? Why torture yourself? Pulse rate can vary by age and sex, but during adulthood, the normal rate generally, now get this, the normal rate during adulthood of the pulse is between 60 and 100 beats per minute. 60 to 100 beats per minute. So if you're on the machine, right, and your heart rate is below 60, you're going to be experiencing what they call bradycardia, or a low pulse rate, right? If your heart rate is over, what is it? 100. It could be 101, 102. But if it's over 100, it's tachycardia. Tachycardia. Your respirations, do they check that? The patient's breathing, respiration is monitored for rate, rhythm, and depth and character. Any respiratory difficulties, either observed or reported by the patient, should be reported to the nurse immediately. That's not always happening, guys. That's why I do these broadcasts, so you'll know. What if you go in and you tell the tech that your mom been having some difficulties breathing? Don't you want to make sure that technician tells the charge nurse? That doesn't always happen. What in case you tell them that and then 3 minutes after that emergency happens? They're going to forget about that. That's why you need to talk to the nurse. You talk to the charge nurse and let them know. Especially if it's respiratory issues or breathing. Respiratories are counted for 30 seconds and multiplied by 2. Right? You're looking at that rate, their chest, the rise when they breathe in. That's how you can tell. Normal rate for adults 12 to 20 breaths per minute. Weight and fluid status. This is also evaluated after treatment. Weight and fluid volume status. Staff weigh the patient. Check for edema. Note any difficulty breathing and note blood pressure. So when you come in dialysis and you leave out with more than you came in there, or your breathing is off the chain. Weight. Recommended interdialytic weight gain. So that's your weight that they recommend between dialysis treatment is between 1.5 to 2 kilograms a day, or 1.5 liter to 3 liters. Edema. Is there dependent or facial edema noted? Respiration rate and quality. Any signs or symptom of respiratory difficulty requires an RN assessment. So if you're not breathing right, you're having trouble breathing at home, you can't sleep, you're laying down, you feel like you're drowning, don't just tell the technician, tell the nurse. The nurse has to then do an assessment. And your blood pressure. If your blood pressure high, then if you got a lot of weight on, 9 times out of 10 you're going to have high blood pressure. All right. This is the equivalence of fluid. 1 kilogram is 1,000 cc's. 1 kilo is 1,000 cc's in fluid. Equals 2.2 pounds. Again. 1 kilogram equals 1,000 cc's equals 2.2 pounds. 1 ounce is 30 cc's and 1 liter is 1,000 cc's. All right, I'm about to take it on home with this, with the weight. All right, with the weight. Because a lot of people have issues or talk about the weight. So we're going to end this broadcast talking about the weight. So one may say, what does estimated dry weight mean? Right? What does estimated dry weight mean? We're going to take it home. So share this broadcast, guys. This is serious because a lot of warriors in dialysis have issues understanding the dry weight, the estimated weight, the average weight, whatever weight. And with that being said, messes up on how much fluid is removed, how much is not removed. Someone ends up leaving with more fluid on, not enough taken off, more taken off than was supposed to. Share this video, share this broadcast. I want to give you 1 minute to take a commercial break, PSA, network break, and get these people so they can understand what's going on, what the warriors need to know, and what I can show you right after this PSA. This is the faces of African Americans with kidney disease. It doesn't discriminate. It affects all. However, these individuals came out to the photo shoot that was broadcasted in 2016 and took it upon themselves to let the world know about kidney disease and how it affects them. Please enjoy Faces of African Americans with Kidney Disease, produced and edited by Urban Health Outreach Media. right, guys, we're going to take this home with talking about the estimated dry weight, what it is, the average weight. So you know when you go back to your unit, or if you don't understand about your weight, I'm about to give you some information to help you understand it and hopefully help you make better fluid decisions when thinking about this. So what does estimated dry weight mean? If you ever heard that phrase, estimated dry weight. When the kidneys fail, they no longer regulate balance. When the kidneys fail, they no longer regulate fluid balance. Patients are unable to rid excess fluid from the body. Dialysis is needed to remove and regulate fluid balance. The nephrologist and dialysis nurse assess the patient to determine the EDW, or estimated dry weight. EDW is an estimate of what the patient would weigh. Okay? What the patient would weigh without any signs and symptoms of extra fluid or edema, and with a standing blood pressure that is normal for them. EDW must be evaluated on a regular basis. So, what tells us the estimated dry weight may be too low? All right, I just told you what the estimated dry weight means. Now I'm going to tell you what tells us if it may be too low. All right, that's where all your symptoms come in. Signs and symptoms of an EDW, or estimated dry weight, that is too low, which is too much fluid, is being removed during the treatment, and the patient has probably gained some weight. Include dizziness, nausea, vomiting, hypotension or low blood pressure, cramps. So if you're cramping during treatment, and fatigue, that sometimes persists until the next treatment. I've talked to many warriors and heard many stories that says they don't feel good until the next treatment. They're tired. They got to go home and rest. They feel dizzy. Well, why do you think? I just told you what they tell the staff, how they educating the staff. What tells us the estimated dry weight may be too low? Right? I'm telling you, this is what they telling them. Signs and symptoms of an EDW, estimated dry weight, that is too low, which means too much fluid is being removed during the treatment, and the patient has probably gained some weight, include dizziness, nausea, vomiting, hypotension or low blood pressure, cramps, and fatigue that sometimes persists, meaning lingers on until the next treatment. That's why you might be feeling that way. You thinking, oh shit, man, I hate dialysis. This is why I hate it. Every time I get off, I'm vomiting and I'm nauseated, I'm tired, and I go home and I sleep until the next day. Do you know what your estimated dry weight is? Right? Or do you even care? This is how a lot of warriors are maintaining quality life if they're in center or at home. They're being mindful. They're being health smart. They're not gaining a lot of fluid. They know how to regulate their fluid intake, how to be mindful during the treatment. Is everything being done? Is everything being checked? That's how they having successful treatments without any problems. Now, it says, what tells us the EDW may be too high? The EDW could be low and it could be high. Signs and symptoms of an EDW or estimated dry weight that is too high, meaning not enough fluid is being removed during the treatment. Patient has probably lost weight because you was in a hospital or your appetite was low. Includes hypertension, headaches, shortness of breath, edema, which is swollen ankles, hands, or puffy eyes, and distended neck veins. You ever seen somebody's neck veins distended? Your dry weight may be too high. Post-treatment weights, blood pressure trends during treatment, need for normal saline boluses to stabilize blood pressure during dialysis treatments, patient status or feelings of well-being or not, all provide information on what may be happening with the EDW. In the treatment weight loss plan, what does AW means? In the weight loss plan, AW means available weight. This is the available fluid weight that needs to be removed from the patient. AW is calculated by subtracting the EDW or estimated dry weight from the patient's pre-treatment weight. In the treatment weight loss plan, how is the goal for fluid removal determined? Target weight. Do you know that? In the weight loss plan, the goal should include the available weight, priming and rinse back. You remember I said that. Prime and rinse back, we use 500, 250 for the prime, the fluid that's in the system before the patient goes on, and 250 to rinse the blood back. You got to add that into the goal to get your net weight. For example, if you want to remove 1,000 liters, 1 cc, you tell the nurse or the tech, set me to remove 1 liter. Then, depending on the unit, what they use for prime and rinse back, let's use 500 for this example. Then you add 500 to that 1,000 cc. So if you want to take off 1,000 liters or 1 cc, you set the machine for 1.5 because you got to give for the prime and rinse back that's going inside you. You got to take it back out. All right. So in the treatment weight loss plan, how is the goal for fluid removal determined? In the weight loss plan, the goal should include the available weight, priming and rinse back, saline, and any other fluid the patient will receive during the treatment, right? Like oral fluids, saline rinses, red blood cells, IDPN, which is the nutritional treatment, IV piggyback medications, etc. Guys, I got a lot of information. I'm going to probably be back on tomorrow talking about the adequacy of dialysis, talking about what improves clearances of urea, about priming the dialyzer, how that's important, and getting the air out. And I'm talking about this thing right here. Yes, the technician has to, when they prime this, they have to get all the air out. Okay? Is that being done efficiently? So tomorrow, tune in for another episode of Kidney Disease Education Moment special broadcast. Then tune in this Wednesday at 7 o'clock as I have on Bella from Tampa, Florida. She's going to be on 15-year